First-time pregnancies often come with a wide range of emotions: excitement, anxiety, stress. As a soon-to-be first-time mom myself, I have endless questions. In the first part of a two-part interview, I have the pleasure of speaking with Dr. Sarah Goodheart, an OB/GYN at Trinity Health Mid-Atlantic Medical Group, who helps first-time moms help keep their emotions in regulation and deliver babies in a healthy and safe environment. Dr. Goodheart, thank you so much for joining me today.
Thank you for having me.
Yeah, I'm thrilled you're here selfishly so I can just pepper you with questions, but I know our viewers are really excited to learn more about what you do. And some of my questions in our first episode today really have to do with labor and delivery, things that you have covered. And I know in chatting with you earlier, you're a mother as well. So you have not only the professional, but the personal experience here. Great. Well, let's start out and just what would your day-to-day be like when you are on the floor for labor and delivery? Like, what does that look like with handling births?
Yeah. So, you go in firstly, round on the labor patients, see who is in active labor, who might need something in the moment. If anybody needs a check to see how far along they are, make sure all the fetal heart tracings are normal. Once I've done that, I'll usually go around on the postpartum patients. So usually labor and delivery has a separate area from the mother-baby unit, which is where all the postpartum moms are with their babies. Mm-hmm. If they've had a vaginal delivery, we'll check their bleeding, make sure that their stitches look good, answer any questions. And then for the moms who have had a C-section, look at their incision, make sure there's no signs of infection, make sure their pain is controlled. And sometimes we answer questions about lactation as well, if moms are breastfeeding. So that's usually how I start my mornings during the day. And yesterday, I had some GYN cases. So I was in the operating room for a couple hours. Mm-hmm. And then when I came back up, it was great because I had two patients who were ready to deliver. Oh. So I had two deliveries back to back, which was great.
Oh, how fun.
And then I had a little break for the day.
Nice.
Yeah.
Wow. Busy.
It was busy.
That's incredible.
Busy is good.
Yeah, busy is great. So actually you helped prompt one of my next questions because I am about 8 months along. And one of the things I've been learning in birthing classes, there is a big difference between C-section and vaginal delivery. Would you care to just elaborate a little bit more for our viewers
Yes.
on that?
So when people think of a natural delivery, they're usually thinking of vaginal delivery. Mm-hmm. So there's two ways that we can now safely deliver babies, natural or vaginal or C-section. Most people will prefer to have a vaginal delivery because they say it is natural, it's, safer, and there are plenty of times where a vaginal delivery is the best option and is safer for mom and baby. There's also times where that's not true and a C-section is actually better or safer. There are certain conditions that a mom might have or that a baby might have that would warrant someone to need a C-section versus a vaginal delivery. Those things could be if the baby is breech, meaning not head down, such as if the baby's butt is first or the feet are first. We don't deliver those babies vaginally because it's not safe. Mm-hmm. If there are twins or multiples, usually most moms will elect to go C-section route because sometimes what will happen is even if twin A does come out vaginally, sometimes there's an emergency and twin B needs a C-section.
Right. So then you're having to handle both at once.
Exactly. So sometimes to avoid some of those complications, moms with multiples will opt for a C-section.
Mm-hmm. No, that makes total sense. I mean, it sounds... Yeah, I mean, it's definitely something I think a lot of first-time moms like myself are, once you get the intel, I think it's helpful because having that sort of information helps you make a decision with your doctor and with your partner. So one thing that mothers who are about to deliver have heard about is the fact that they're classified as a high-risk pregnancy. Would you care to elaborate for us on what that means and maybe how people can approach their pregnancy if they're told they're high risk?
Yes. So a high-risk pregnancy is usually anybody who should be seeing their doctor more frequently for anything that could potentially cause harm to themselves or the baby. So these could be things such as mom having hypertension. This could be high blood pressure that started before the pregnancy or during the pregnancy. This could be diabetes, something that mom had before pregnancy, or gestational diabetes that happens during pregnancy. We usually consider IVF or in vitro fertilization pregnancies to be a little bit more high risk just because of all the work that goes into conception, and all things that, might mean that mom needs to be taken care of a little bit more than, let's say, a low-risk pregnancy.
So would age be a factor as well?
Age can be a factor too. So there are things like age, maternal BMI or body mass index that have been proven to have some potentially negative consequences on mom or baby. So we like to do a couple more ultrasounds in those pregnancies. We might have them come into the office a little bit more frequently, just so we can keep an eye on mom and baby and make sure they're both safe.
Yeah, that's great. I think, it helps set moms at ease having that good kind of care from your office. So one thing I've heard about in terms of going back to the delivery question is an epidural. I think we've heard it yelled out in movies too.
Yes.
What is an epidural, if you don't mind defining that for us?
Yeah, so an epidural is an amazing medical technology now. So it's medication that goes through the spine. So an anesthesiologist will place the medication through the back, and it is a block that kind of blocks pain receptors so that the mom can be comfortable through the duration of labor and for pushing. It's not a complete block where you don't feel anything. You'll likely still feel pressure. You might still feel some contractions, but nowhere near the pain, say, that someone might come in with when they start having contractions.
Understood.
And this way, mom can still feel that pressure. They can still push and then have a delivery.
So you don't lose your ability to push. It's more just like you said, blocking some of those pain receptors.
Exactly.
Got it. That's helpful to know. Do you recommend a birthing class to your patients?
Absolutely.
Yeah. Does it help ease anxiety? I'm sure you've probably
It does.
seen.
I think a lot of the anxiety around birth stems from lack of information. And I don't know that most people know what to expect unless they've gone through it before or have watched someone gone through it before. So having the classes where they can have somebody teach them what to expect, what's the process, what this day could look like for them, just kind of erases some of those fears of the unknown. And that way, when the big day comes, they say, oh, I remember this, I remember that. It'll never be exactly like somebody plans, but at least some of that fear of the complete unknown.
It makes total sense. I mean, it's like moving to a city, like doing your research before.
Yes, doing your research, absolutely.
Yeah. So one thing that you had shared with me is that you are a mother yourself, but you had done your training and had been in residency before becoming a mother. How has that experience shaped for you the way you practice now, maybe versus before you had your first?
So in training, you're learning what's normal, what's not normal, how to take care of a pregnant woman, how to take care of a baby. And these are all things that you've learned through people teaching you. And then once I became pregnant and delivered at the hospital where I was working, and then, becoming a new mom, going through all of my postpartum journey, and then coming back to work and back to taking care of pregnant women and new mothers, I had a completely different outlook.
Wow.
I was much more empathetic. I was much more understanding. And I feel like I just had more knowledge in general, because unless you've gone through it yourself, all you have is what you've learned and read and what somebody's taught you, but then having experienced it firsthand and knowing what things feel like, what I was anxious about, what I still had questions about. And that way I could better impart that information to other new moms.
Yeah, that's great. So again, another selfish question, but I know our viewers will appreciate it as well. Any advice that you can offer to soon-to-be first-time mothers while they navigate this amazing, glorious, wonderful experience of pregnancy, but with the knowledge it also can be stressful too?
The best advice is to ask questions. Sitting in your own head, Googling at 2 a.m. when something comes up that you're nervous about, call your doctor. Doctors are on call for a reason. And if you're nervous about something or you have concerns that something's not right with the baby, you should ask. Because the last thing you want to do is assume everything's okay if there might be a problem. And moms have a really good sense of their own body, their own baby, what's going on at the time. And if they think they should come in and be evaluated, you call your doctor and you tell them.
I love that.
Yeah.
And that's a resource that through the Mid-Atlantic Health Group.
Absolutely.
Yeah, that's
24-hour service.
Oh, I love that.
Even if it's just a phone question.
It gives soon-to-be moms like myself so much ease. I really appreciate that. Well, I appreciate your time. Thank you, Dr. Goodheart.
Thank you.
And I'm really excited that we get to welcome back Dr. Goodheart in our next episode, where Dr. Goodheart and I will speak about afterbirth, postpartum, and what women can do to prioritize their health as they welcome their babies into the world. We'll see you in the next episode.